Continuing our discussion in the front of the thigh. So after finishing the contents of the superficial fascia, now we are going towards the deep fascia of the thigh. Whether it may be a front, medial side or back of the thigh, the entire compartment of the thigh is covered by the deep fascia, which is called as fascia lata. So here I want to say that fascia lata is called as the deep fascia of the thigh. So now we are discussing the front of the thigh. So here I will explain you the extensions of the fascia lata in this region. Okay, so we are going to discuss about the deep fascia of the thigh, which is called as fascia lata. Fascia lata, actually a deep fascia which covers the entire thigh like a sleeve, which means the fascia is present at front, at medial, at back as well as at the lateral areas, right? So if you see the attachments of this fascia lata, it has superficial attachments or superior attachment, inferior attachment, anterior, posterior, medial as well as lateral attachments. Okay. So let us see about the attachments of the fascia lata or deep fascia of the thigh. So now first let us talk about the superior attachment of the fascia lata. Superiorly, fascia lata is attached to the boundary line between the pelvis and the lower limb, where there is a boundary line between the pelvis and the lower limb, from where the fascia lata starts arising. So superior attachments of the fascia lata is a boundary line between the pelvis and the lower limb. So superiorly it is attached to the boundary line between the pelvis and the lower limb. So where anteriorly it is attached to the inguinal ligaments. Okay, so its anterior attachments, anteriorly inguinal ligament. So you know that the inguinal ligament forms the anterior boundary. So from there anteriorly it gives attachment to the inguinal ligament. From there it goes laterally. So laterally, what structure you can find here? After giving attachment anteriorly to the inguinal ligament, it goes laterally. Laterally it gives attachment to the line along the iliac crest. Okay, so first it gives attachment anteriorly. You know, anteriorly you have the inguinal ligaments. After fascia lata attaches anteriorly, it turns laterally. Laterally it gives attachment to the line along the iliac crest. So here you can see this is the dotted line is the attachment of the fascia lata. So superiorly it is attached to the boundary line between the pelvis and lower limb. Anteriorly it is attached to the inguinal ligament. And if you see laterally it attaches to the iliac crest. Anteriorly it attaches to the iliac crest, and from there it reaches posteriorly. Anteriorly it attaches to the iliac crest, from there it reaches posteriorly through the gluteal fascia, because the fascia enters into the gluteal region. Through the gluteal fascia it attaches to the sacrum and coccyx, and there it also attaches to the sacrotuberous ligament. Okay, so laterally after it gives attachment to the iliac crest, the fascia runs posteriorly through the gluteal fascia, because you know the posterior aspect you have the gluteal region. So posteriorly through the gluteal fascia it gives attachment to the three important structures. One is the sacrum, coccyx and sacrotuberous ligament. So posteriorly it gives attachment to the sacrum, coccyx and ST ligament. Remember, it is called as the sacrotuberous ligament. Understood? So after it attaches posteriorly, again it turns towards medial side. So remember, here we are discussing the attachment of the fascia lata, anterior inguinal ligament, and it goes laterally. So laterally, the lateral side of the upper part of the thigh, you have the iliac crest. So laterally it attaches to the line along the iliac crest. From there it runs posteriorly through the gluteal fascia. From there it gives attachment to the sacrum as well as coccyx and to the sacrotuberous ligament. From sacrotuberous ligament, the fascia runs medially. So medially it gives attachment. Here you can see medially it gives attachment to the pubis, pubic arch, pubis as well as pubic arch. So like that it gives attachment anterior, lateral, posterior as well as to the medial side of the thigh. So the main structures of medial are pubis or pubic arch, pubis as well as pubic arch. So these are the important structures where it attaches medially. So superiorly it is attached to the boundary line between the pelvis and the lower limb, anteriorly inguinal ligament, laterally the line along the iliac crest, posteriorly through the gluteal fascia it gives attachment to the sacrum and coccyx and to the sacrotuberous ligament, and medially it attaches to the pubic arch as well as to the pubis, and from there medially it gives attachment to the pubic arch as well as to the pubis, and these are the attachments of the iliac crest mainly in all these aspects. Now if you talk about the inferior attachments, we discuss about the superior attachments. Inferiorly the fascia lata attaches to the front and sides of the knee. You know that if you see the front as well as sides of the knee, it gives attachment to the joint capsule of the knee joint, and also in the front as well as sides of the knee, the fascia lata also gives attachment to the subcutaneous bony prominences. Now if you feel the knee joint, on the lateral aspect you can feel the lateral as well as medial condyle of the tibia, right? These are the bony prominences. So by the time the fascia lata reaches inferior, it attaches at front of the knee as well as sides of the knee, where it gives attachment to the capsule of the knee joint, and also it gives attachment to the bony prominences in the sides as well as the front of the knee. So if you talk about the inferior attachments here, inferior attachments, front and sides of knee, front as well as sides of knee. So here in the front as well as sides of knee, what happens here? It attaches to the joint capsule as well as it also gives attachment to the subcutaneous bony prominences in that region. So here I will mention that point. So capsule of the knee joint, and also subcutaneous bony prominences. So inferiorly it attaches to the front as well as sides of the knee, where it gives attachment to the capsule of the knee joint and also subcutaneous bony prominences. And at the same knee joint posteriorly, you have the popliteal fossa. Popliteal fossa is covered by the popliteal fascia. So by the time the same fascia lata reaches the popliteal fossa, it forms the strong popliteal fascia. So here I will write back of the knee. Okay, back of the knee, it forms popliteal fascia. Remember, the fascia lata itself, by the time it reaches the popliteal fossa, it forms a strong popliteal fascia. It forms popliteal fascia, and from the popliteal fascia it extends downwards to the back of the leg to form the deep fascia of the back of the leg. Like that, the fascia lata is extended superiorly to the inferior. From there it attaches to the front as well as sides of the knee. From there it forms posteriorly to form the popliteal fascia of the popliteal fossa. From there it extends downwards to the back of the leg to form the deep fascia of the back of the leg. So this is called as the fascia lata. Now if you talk about some important aspects about the fascia lata, we studied that laterally it attaches to the iliac crest, right? We studied. But one important point you need to remember that the fascia lata on its lateral side, it forms a thick band-like structure called as iliotibial tract. I will repeat it again. Laterally, the fascia lata forms a thick band-like structure called as iliotibial tract. So I will show you the attachments of the iliotibial tract here. So if you see, this is the tubercle of the iliac crest, or let us discuss that is the iliac crest here, right? Now we will see the attachments of the iliotibial tract, and let us assume that this is the head of the femur. So now we are discussing about what is iliotibial tract. By the time the fascia lata reaches lateral aspect of the upper part of the thigh, it forms a strong band-like structure called as iliotibial tract. This iliotibial tract extends from the iliac crest. Here you can see, extend from the tubercle of the iliac crest. The tubercle of the iliac crest, which is present on the outer part of the iliac crest, or external part of the iliac crest, it is attached to the tubercle of the external part of the iliac crest, and also it extends from the capsule of the hip joint, which means by this you came to know that in its upper part the iliotibial tract splits into two, right? Or you can say in its upper part the iliotibial tract has two lamina. Iliotibial tract has two lamina. One is towards the superficial aspect. I will say it is called as the superficial lamina, and this is called as the deep lamina. So in its upper part, the iliotibial tract splits into two lamina. One is the superficial lamina, another one is the deep lamina. The superficial lamina of the iliotibial tract gives attachment to the outer tubercle of the iliac crest, okay, or tubercle of the iliac crest, which is present on the outer aspect of the iliac crest or external aspect of the iliac crest. And the deep lamina blends with the capsule of the knee joint, or deep lamina, simply remember, it attaches to the capsule of the hip joint, right? Superficial lamina gives attachment to the tubercle of the iliac crest, that is external part of the iliac crest, and deep lamina gives attachment to the capsule of the hip joint. And if you see these two lamina, in between the two lamina, it gives attachment to the two important muscles. I will repeat here again. This is the superficial external attachment, and this is the internal attachment, or superficial or deep attachment, or in simple terminology we can say this is the superficial lamina of the iliotibial tract, and this is the deep lamina of the iliotibial tract. Only in its upper part it splits into two. By the time it reaches the lower part, the superficial lamina and deep lamina blends together to form a strong band-like structure, okay. So where the gap is present in its upper part between the superficial lamina as well as deep lamina, it gives attachment to the two important muscles. So what are the muscles? We will see here. It gives attachment to the two-thirds of the gluteus maximus, and also it gives attachment to the tensor fascia lata. So what are the muscles are attached to the gap between the superficial and deep lamina of the iliotibial tract here. It gives attachment to the gluteus. It gives attachment to the gluteus maximus, and it gives attachment to the tensor fascia lata. It gives attachment to the tensor fascia lata. So now, after the superficial and deep lamina blend together to form a strong band-like structure, it finally reaches the condyle of the tibia. This is the tibia, this is the medial condyle of the tibia, and this is the lateral condyle of the tibia. So finally it extends downwards to the knee, where it attaches to the anterior surface of the lateral condyle of the tibia. So this is the smooth surface or anterior aspect of the lateral condyle of the tibia, where the iliotibial tract is attached. So it extends laterally. So what is the iliotibial tract here? Remember that iliotibial tract is a part of deep fascia of the thigh, is a part of fascia lata. The lateral part of the fascia lata forms a thickened band-like structure called as iliotibial tract. In its upper part, the iliotibial tract splits into two lamina. One is called as the superficial lamina, another one is called as the deep lamina. Superficial lamina gives attachment to the external part of the iliac crest, where the tubercle of the iliac crest is present, and the deep lamina gives attachment to the capsule of the hip joint, and the space between the superficial and deep lamina gives attachment to the two muscles. One is called as the gluteus maximus and another one is called as the tensor fascia lata. And in its lower part, the superficial and deep lamina blends together to form a strong band-like structure which extends downwards towards the knee, where it gives attachment to the lateral condyle of the knee joint in its anterior smooth surface. Okay, so this is the attachment. Now, what is the importance of this iliotibial tract? So remember that iliotibial tract mainly stabilizes the knee laterally. So this is the main important function of the iliotibial tract. So strengthening of the knee from its lateral aspect is mainly done by the iliotibial tract. Not only that, whenever a person is doing an action called as flexion of the knee, the iliotibial tract moves posteriorly, while a subject is performing extension of the knee, the iliotibial tract moves anteriorly. So the movement of this iliotibial tract takes place continuously during flexion as well as extension of the knee, which means it is very important during walking, where the extension as well as flexion of the knee, whenever it is taking place, the movement of the iliotibial tract is taking place. Specifically, whenever a person is slightly leaning forwards with a semi-flexed knee, I am repeating again, whenever a subject is slightly leaning forwards with a semi-flexed knee, this iliotibial tract forms an important structure to stabilize the knee joint against the gravity. What is the important point here? Whenever a subject leans forwards with a semi-flexed knee, this iliotibial tract forms an important structure to act or to stabilize the joint against gravity. So this is the importance of the iliotibial tract. Now, one important point, if you see the clinical aspect of the iliotibial tract, there might be a inflammation or irritation of the iliotibial tract where it attaches to the lateral condyle of the tibia. So majority of the athletes have a complaint of lateral knee pain. Remember that the most common cause of lateral knee pain is due to the irritation of the iliotibial tract where it is attached to the lateral condyle of the tibia. So whenever if you see a case of an athlete having a lateral knee pain or pain in the knee on the lateral aspect, remember that it may be due to the irritation of the lower part of the iliotibial tract near its attachment. Okay, so this is the, by this we finished what is fascia lata, what is the iliotibial tract, and also we completed the clinical importance of the iliotibial tract.